Thailand, the Southeast Asian nation known for its street food, beaches, and dangerous traffic, has been chosen by the World Health Organization to be spotlighted alongside New Zealand in an upcoming documentary on successful models for responding to COVID-19. The international attention may be warranted since, as of August 10th, Thailand has logged 75 consecutive days without locally transmitted cases of COVID-19. A continuous trickle of cases has continued to be recorded in the kingdom as Thais are repatriated from abroad and a small select group of foreigners are allowed back into the country. All of these cases, however, are detected via mandatory testing that is conducted throughout the required 14-day quarantine that anyone arriving from outside the country must fulfill. All of this success has occurred despite the fact that Thailand was the first country to detect a COVID case outside of China in early January, and despite a study from the Imperial College in London released in February that identified Thailand as most at risk for importation of the virus from China, due to Thailand being the #1 destination for Chinese travelers. How has a country of 67 million recorded a total of 3,351 cases as of August 9th, half as many cases as Luxembourg, which has a population 100 times smaller than Thailand, and about the same amount that the United States was recording every hour on average during the month of July? So what factors have contributed to this success, and what can we learn from Thailand? In today's video, I'm going to give the top 5 reasons why Thailand has had success in mitigating the spread of the novel coronavirus. Reason number 5. Consistent messaging and fact-based communication. The Thai government established the Center for COVID-19 Situation Administration, or CCSA, to create a central clearinghouse for official policy and daily updates on statistics. However, a big turning point occurred on March 23rd when the CCSA appointed Dr. Taweesin Wittsinayothin, a psychiatrist in the Ministry of Public Health, as its official spokesperson. Dr. Taweesin is charismatic and has been able to gain public trust through transparent presentation of data, including daily cases, testing, polls on public opinion, and government response. This charismatic spokesperson has been able to generate public trust in his daily briefings. His official but raw data has generated acute awareness of what must be done to prevent the spread of the virus. Dr. Taweesin was able to communicate directly with the public, and this resulted in growing awareness and subsequently translated into solid understanding and cooperation. This was not always the case in Thailand. Before setting up the CCSA, there was no leadership in directing the fight against the virus, with politicians jockeying for position. Each agency was doing its own thing, often issuing contradictory guidance. It was at this time in mid-March, when cases were spiking in Thailand and leadership was scant, that I was publishing articles warning of the peril Thailand was in at the time. The CCSA centralized the entire antivirus campaign to fight the virus. Reason number 4. Social norms. A number of social norms have been protective of Thais during the pandemic. First, Thais are generally very hygienically minded. For example, you always take your shoes off before entering anyone's house, and even many communal spaces. The focus on hygiene means it's absolutely normal for all people, myself included, to take at least 2 showers a day. It's hot, and a shower is just a good way to cool off and rinse off the sweat. When greeting, there is no such thing as kissing cheeks or shaking hands like in the Middle East or Western cultures. The Y, a greeting of 2 hands pressed together, is instead the norm. A hygienically minded society means Thais were quick to adopt increased hand washing and other measures to reduce the spread. It also shows how Thais were broadly scared of the virus and very risk averse. Throughout March, around 80% of Thais reported being scared of catching COVID, as compared to around 30% in most European countries. Everyday practices like frequent showering and wying also left fewer opportunities for virus transmission. Reason number 3. Mask compliance. Throughout March, as the WHO flip-flopped on its mask guidance and public health officials in the U.S. even advised against even buying masks, Thais wholeheartedly embraced masks. By the end of March, more than 90% of Thais reported wearing masks in public, according to a survey of global face mask use by the UK research firm YouGov. This is in contrast to around 40% in Spain, 20% in France, 15% in the US, and around 5% in the UK. Masks were nothing new in Thailand and across many other Asian countries. Air pollution is a serious problem in Thailand during the stagnant, rain-free months of January, February, and March. Once fears of infection escalated, mask wearing became nearly ubiquitous. Further reinforcing this is a shared communal society in which serious social pressure is exerted to join together and be part of a communal effort. Whether it's wearing the same color shirt, banning plastic bags, or wearing face masks, Thai society is a communal society, so there's a strong desire and pressure to fit in. Certainly, the consistently high percentage of people wearing masks in Thailand has mitigated the spread of the virus. Reason number 2. An extensive primary healthcare system. Primary healthcare is the building blocks of every health system. Primary healthcare is more than just healthcare delivery, though. It also includes health education and community participation. In Thailand, primary healthcare is the responsibility of the health-promoting hospitals, or HPHs, located at the sub-district level. Every single one of the more than 7,000 sub-districts, or tambons, in Thailand has an HPH, which is a small outpatient facility that can organize screenings, immunizations, health education, and basic health services as part of its role as primary health care provider. Most importantly, these local health centers partner with the local village health volunteers, or VHVs. Across the country, more than 1 million VHVs serve as community health workers, receiving a small monthly stipend for their service. Each VHV is responsible for overseeing around 10 households in his or her community, checking in with the households, spreading information, and encouraging household members to seek medical care when necessary. Importantly, these community health workers are the eyes and ears of the health system. If someone is not well or anyone has recently arrived from outside the village, it can be guaranteed a VHV has his or her eye on it. And the number one reason why Thailand has been able to mitigate the spread of the COVID-19. The D614G mutation never got established in Thailand. While Thailand has done some things right and has beneficial characteristics about it, it has also had a bit of luck. The D614G mutation refers to a specific mutation of the virus's RNA nucleotide, the one located at position 23,403 in the RNA strand, from an A to a G. Because of that mutation, the amino acid produced by that RNA code switched from a D to making a G, hence the name D614G. As it turns out, that amino acid is part of what builds the spike protein, those little spikes on the crown that you see on the outside of the virus shell. This slight variation in the spike protein is believed to have produced more stable spikes on the virus shell and enhanced the transmissibility of the virus. This mutation was first detected in Europe in late February, possibly originating there. A key study came out at the beginning of July that showed that this genetic variant took over to dominate the global pandemic, becoming the dominant form of the virus in every place it was introduced. Starting in Europe, it spread to the eastern US, South America, and beyond. Incredibly, this genetic variant never really arrived in Thailand. By the time it was widespread in Europe in late March, Thailand had begun to limit international arrivals and European tourism was waning. So while Thailand may have been the first country outside Europe to detect COVID-19, it was the original Wuhan variant, which apparently was not quite as contagious. Thailand essentially dodged a bullet. So there you have it, 5 reasons why Thailand has had success in containing the spread of COVID-19. A mixture of ingrained societal norms, long-standing and effective public health institutions, a fact-based response led by medical professionals, and even a bit of luck. Time will tell whether this success continues, as several countries with long streaks without local transmission, including nearby Vietnam, have seen sudden, unexplainable spikes in cases. Stay tuned for more information in the future, and thanks for watching. If you like this video, check out some others on other public health topics. Be sure to subscribe to receive future videos, and as always, thanks for watching.